We are good. Turn it over to y'all.
Hello, everyone. I am Melissa Funderburk. I am the Region 3 Operations Manager for NC Counts Coalition Healthier Together. NC Counts Coalition is a 501c3 nonpartisan organization. We have partnered with the state of North Carolina to create Healthier Together to help HMP communities with vaccinations and testing in the midst of this COVID pandemic. I also come with 30 plus years in healthcare and activist work. We will be doing a presentation through PowerPoint. I will share my screen. I will do half and then I will pass it off to Deborah and Liana. Let me see about sharing my screen. Let's see. Okay, bear with me here. Love technology, right? Okay, I don't see my screen. Let's see. Okay, can everyone see that? Okay. Okay, so with Healthier Together, we encourage vaccination. And here you see it says, don't wait, vaccinate. We try to assure that everyone knows the guidelines, their do's and don'ts, to take away some of the fears of getting vaccinated. Comments, concerns, we'll have at the end, when we finish speaking, we'll have a Q&A. So what I encourage anyone to do, if you have a question or any concerns, to sort of jot them down so you won't forget them at the end, and one of us will address that. COVID, how has it impacted the state of North Carolina? The state of North Carolina has nearly 1.3 million cases and over 15,000 deaths. That's a lot. Hospitals are almost full. In the beginning of the pandemic, I remember working the COVID unit where we even had to do mobile morgues. So that's why we want to make sure people get vaccinated so we don't go back to where we was in the beginning. We're going to go over some facts about COVID-19. And I want to say, it's those aside say COVID-19, let's not forget we're also dealing with the Delta variant. So this is also pertaining to this COVID in general, okay? COVID is spread by the air. You may hear people say, well, it's airborne. In healthcare, you have contact, you have droplet, and you have airborne. Airborne is the one that's most contagious because it floats in the air. It floats in the air, and I like to, when they say something is airborne, let's say someone coughs that has no face covering, and you don't know that, and you don't have covering, and you walk into it, it's floating in air. It's something like when you spray the mist in your home, the air freshener, how the particles float, that's what it is with airborne, okay? And when it says symptoms may appear 2 to 14 days, I've had people tell me, well, I haven't had any symptoms, or I didn't get symptoms until day 7. Just know with COVID, it doesn't mean that day 3 that a lot of people hold on to, that by day 3 you're going to have symptoms. You may not have symptoms until day 10, and some people are asymptomatic. Asymptomatic means you have no symptoms at all. However, you are contagious. And viruses. I had someone to ask me in an education session. At first they were saying no mask. Now they're saying mask. Everything keeps changing. Why do it keep changing? Well, viruses are very smart. They are very smart. They're continuously replicating themselves, improving themselves. So in the beginning, we come out and we said, okay, let's do this. And then you start hearing these variants and they're like, you're telling us to get vaccinated, but it's more coming up because the virus is replicating and it's getting smarter. And the more of us that's not vaccinated, it gives that virus more strength and more power. The more that we are vaccinated, it runs up against a wall and it's not able to do what it is created to do. So that's why vaccinations are important, because the virus will continue to replicate itself. Viruses are smart. Okay, the Delta variant. The Delta variant has almost replaced all other variants. When the Delta variants came about, we realized the Delta variants spread it a lot quicker than the original variants did. In the medical field, we realized that, okay, we're seeing this here variants is spreading, and this time it's getting our younger population. When COVID-19 first came out, if you can recall, you heard about, oh, well, we're not having children with it. And the Delta variant COVID-19, it was hitting mostly older adults, and it wasn't hitting our children. Well, when the Delta variants came out, it started also attacking our babies. It started spreading more easily. But vaccines, all three of the vaccines work very well at protecting you against all of the variants that we found so far. So that's a good thing, and that's why it's important to get vaccinated. Unvaccinated people remain our biggest concern. That's why we work so hard at making sure in the communities where we see the COVID cases high and the vaccination cases low, we work to try to turn that around, because unvaccinated people are our biggest concern, because if they're unvaccinated, that virus is able to use them as a host to spread it to the rest of us. Okay, with some terms, some COVID terms, I'm gonna move this down a little bit. Okay, here we go. With some COVID terms, nearly all new COVID-19 cases, let's say COVID cases, are people that are not vaccinated. What we're hearing a lot, and I'm hearing in the field and in our communities is, well, what's the use of getting vaccinated if you're still gonna get sick? With getting vaccinated, what we're seeing, people that's in the hospital on life support, a ventilator, I like to say life support. I like to not try to speak so much medical terminology. I want to speak English everyone knows what life support is. So the more people that we're seeing on life support dying are unvaccinated people. And they said, well, I heard somebody that was vaccinated also died and got sick. We're looking at a 2% or less. And with them individuals, they had a lot of underlying health conditions that came. And in the medical field, they may have caught COVID, but they didn't die from COVID to say. It could have been their blood pressure, their obesity. It's a lot of other things that come into play. So unvaccinated people, you get a higher chance of getting the Delta variants, which spreads more easily and is causing a lot more sickness and hospitalization. With vaccination, you will get COVID. My son was fully vaccinated after I convinced him. He was fully vaccinated, caught COVID, isolated himself so he didn't give it to his children. And when I was checking in on him, he was still singing and everything, in isolation. And he told me, he was like, Mom, I really believe if you wouldn't have convinced me to get the vaccine that this would have killed me. So yes, even though he was fully vaccinated, he caught COVID, but guess what? He didn't have to go into the hospital. My sister was fully vaccinated. Her 11-year-old daughter brought it home. Her husband was negative, she was positive. She had underlying health conditions, which was asthma and obesity. Because she was fully vaccinated, yes, she lost her smell, she lost her taste. However, she did not have to be hospitalized. So that's the difference in being vaccinated and being unvaccinated. You know, we can't push that enough. Vaccines do work. They do work. Many of you may hear the term long-term effects or long haulers. What we found with COVID, even working the COVID unit, there are some long-term side effects. Everyone don't have them, and they don't touch everyone the same way. However, you may find the fatigue or the shortness of breath, even though you've tested negative after the virus, but some stuff linger on with you. That's why it's encouraged as you can to start, you know, exercising, trying to build that up. But there are some long-term. However, the long-term effects is not showing up as much in vaccinated people. So it is important, once again, to get vaccinated, you know, so you don't have to worry about that shortness of breath all the time. It doesn't mean you won't have it, but it means it won't be as severe. Long COVID, like I said, when it continues with symptoms 4+ weeks. And with that 4+ weeks, just don't think, oh, well, is this gonna last a month? Sometimes it goes even longer, you know, with the fatigue, feeling tired, the brain fog. Brain fog is when I just can't talk. I don't know what's wrong with my brain. You know, I just can't remember. You know, you have them moments. The headaches. Headaches can be, you know, more annoying than painful. Muscle aches, fever. And sometimes the fever is not even accompanied when you first get COVID, but it starts tapering off. You start noticing a low-grade fever. Them are some of the long-term symptoms of COVID. However, the vaccinations do help. About COVID-19 vaccines. With COVID-19 vaccines, all three, Pfizer, Moderna, Johnson & Johnson, all three of the vaccines have been proven effective against COVID. Like I said, all three of the vaccines have been proven effective against COVID. COVID vaccines are tested and safe and effective. The FDA, the Federal Food and Drug Administration, continues to check the safety. What I will say is, from a healthcare perspective, as well as a medical laboratory scientist, vaccines, a lot of things came up. Oh, they did it too quick. They did it too quick. It's certain protocols that have to be followed in the labs when you're creating stuff. I think the best way, when we're doing education sessions, one of the best ways to explain how this process moved is people say so swiftly. Let's say you have something that you done put together. You done worked on it, you done followed all the protocols, but everyone knows that administration step is sometimes longer than the process itself. Well, with COVID-19, when they got it, they was able to take it, instead of sitting it on a desk somewhere, they was able to skip that step and take it straight on to where it needed to be, to the Food and Drug Administration. So Yes, it has. They went through all the protocols that need to go through. It moved quicker because they was able to skip some of the administration steps, not the lab and the science steps. It's certain protocols that we have to follow. We have to follow them. Many people don't know. A lot of times, majority of times, not just with COVID, any vaccines, before it gets to the public, doctors, healthcare professionals, even the general public have been in trials. And in trials, it means, yes, you can test me. Let's try it on me. For one, try it on me, guess what? By the time the public get it, I've already had my shot. The same way with the children, the 5 to 11-year-olds now. Many doctors have placed their children in these trials because they trust the process. Trials, adults went through the trials. Some, they didn't know what was getting the gazebo of the vaccination. But so they went through the trials. So you need to know, before it comes to the public, that's one thing. And vaccines are working to lower the number of deaths. We're seeing it in our numbers that we see. However, we're also seeing more people still need to get vaccinated. COVID vaccines are built on decades of research on vaccines for similar viruses. Now, when COVID first came out, one thing that came up to me, I had people coming to me and saying, Melissa, they act like this is new, but I remember seeing on the can, this disinfectant can, I seen COVID on there. We have had so many similar viruses, and when viruses come, it's a category that they come in. And so it may be like we have COVID-19, we give a number or a name connected to them. However, it's not the same. The one that was here before was not the same as this one. So just to let people know, there's been a lot of research, a lot of investments going into fighting this. And medical science, I have to say this, medical science has been tried and true. Yes, the Black community has reasons for fear. I get that. However, I can't help but think about my young sister, my little sister that died from AIDS. I remember telling her, if you can just hold on, one day they will have it where you don't have to take all these pills. Because during the time she was doing the cocktail, which was a series of medication for HIV. Needless to say, she lost that fight. And today I have friends that was positive at the same time she was, and they're not having to take all them pills. That's because medical science did the work and found out we can help it where they're not having to have all these side effects and take these pills. So we do have a history where medical science do work. Why should I get the COVID vaccine? I always tell people, if you don't want to do it for yourself, do it for your family, your community. Soon as I was able, I got my vaccination. And it wasn't so much, when I got the vaccination, I have to be honest, it wasn't so much me worried about me getting sick. I have 5 grandchildren that I love. And I wanted to make sure that Mama, as they call me, if I get this virus, I need my grandchildren to know that Queen Pam Melissa went down with a fight. I'm going to give it the best fighting chance I have. And I remember when I was telling my oldest son that I was going to get the vaccine, and he told me, he said, Mama, you get that vaccine, you're going to grow 3 arms. I said, okay, I'll grow 3 arms. And that means instead of me just having 2 arms to hug my grandchildren, I'll be living and I have 3 arms to hug my grandchildren. So get the vaccine, think about your loved ones, think about, even I did a education session with pet lovers. Think about, if I get COVID, if I don't get the vaccine, I get COVID and die, what's gonna happen to my children? Who's gonna take care of my children? Who's gonna take care of my pets? Nobody takes care of our people like we take care of our people. That's why we're in the community out here in our Black and brown communities, and we're pushing and we're fighting because we want to take care of our people. So think about who you want to do it for if you don't want to do it for yourself. Because sometimes saying do it for yourself, we're finding in the community that's not enough. So think about grandmama. Think about your babies. Think about your pets. You know, a lot of people laugh when I say pets. When I did I went to a dog birthday party and did an education session. And thinking about, if something happens to you and someone has to keep your pet, are they gonna still give them the love and care that you give them? I don't think so. So it's not all about you. It's also about, I love my family and my community enough that I'm willing to give this a fighting chance and get vaccinated. How do vaccines work? Okay, the $1 million question, okay? When you get your vaccine, they are not giving you COVID. They are not putting COVID in you, okay? And I think, you know, my sister got mad when I used this reference, but the best way I can do, a lot of you love that almond milk. I'm a country girl. Give me, the best I can do is lactate-free milk, you know, but a lot of people love almond milk. And they came up with almond milk, because telling my age, I remember back in the day, Deborah, they didn't have no, it wasn't no such thing as no